Hello, I'm Bob Chaloner. I'm the President and CEO of Southampton Hospital, and I'd like to welcome you to another edition of Focus on Southampton Hospital, your monthly program about your community hospital. Today's program is actually a very, very interesting and topical program. We've all been struggling with the tick and tick-borne diseases. We've heard about Lyme disease. Many of us have heard about ehrlichiosis or babesiosis, some of the diseases born by ticks, and unfortunately it's an epidemic that we do have in our community. Today we're going to learn about a meat allergy actually that is linked to ticks, and my guest today is Dr. Erin McGintee. Dr. McGintee is an allergist, pediatric allergist. Practices in East Hampton and also on the North Fork, and also a product of our local community here. Dr. McGintee grew up out here. We'll learn a little bit about her career path, and it's always so wonderful to welcome a local person who's gone off and trained and come back to serve our community. So welcome, Dr. McGintee. Welcome on so many levels.
Thank you.
So let's start off a little bit about you and your career path before we do get into the discussion about ticks and meat allergy. How did you end up in practice, and how did you decide your specialty? So, and you are local. You grew up in East Hampton, right?
I grew up. I'm an East Hampton High School graduate.
Right.
And I went to college down at Mary Washington College in Fredericksburg, Virginia, which is now University of Mary Washington. I got my Bachelor's of Science in Biology, and a secondary major in music while I was down there.
Right.
And knew I wanted to be a physician. I wasn't quite sure where I wanted to go with it at that time.
Went to East Hampton High School?
I was the valedictorian of East Hampton High School.
Oh wow, go Bonikers,
1992.
Right? Okay.
And I got accepted to medical school at State University of New York at Stony Brook. So I came back to Long Island.
Right.
Studied there for 4 years and decided to go into a pediatric residency.
Okay.
I always had an interest in taking care of children, and so I did my 3-year pediatric residency down in Philadelphia at the Children's Hospital of Philadelphia.
Okay, wonderful institution actually.
Very proud of it.
Yeah.
#1 in the country, according to a lot of sources.
That's right.
So I had excellent training down there, and had exposure to a lot of subspecialties in such a great tertiary care pediatric institution. And I initially became interested in allergy because of the asthmatics who we were taking care of in inner city Philly, and they kept ending up being hospitalized again and again. And I kept thinking if we could just get to the root of why they're sick and address it on an outpatient basis, then we could keep them out of the hospital. And there's no one better at doing that than an allergist, because most triggers for asthma are allergic.
Allergy related, right.
So I ended up staying down there. I got accepted to the Allergy and Immunology Fellowship at Children's Hospital of Philadelphia, which is a 3-year program. I did some research in inpatient hospital asthma in children.
Right.
And I did my adult training, because allergists see adults and children regardless of their residency, next door at the hospital of the University of Pennsylvania.
So I should clarify my earlier remark. I said pediatric allergist. You're really actually a pediatrician and an allergist, so you do see adults also.
I love seeing kids still to this day, but I see the grown-ups too. And I stayed down there for a while, but my heart was always back here. My family's here, my friends are here, the ocean's here, and I always had the intention of coming back. And I was fortunate enough that a couple of years out of training, I hooked up with this great group of ENT, ear, nose, throat physicians out here. They took me on. And
are you the only allergist in their group? And I know ENT and Allergy Associates, it's a large group of specialists who are, not only out here, but actually through the entire tri-state region. We've got a couple of members on our medical staff in the ENT department. You're the only allergist out here in this area? Okay.
Yeah, the model for the group is a couple of ENTs for one allergist. And it's all the ENT guys and me.
And you are seeing patients in East Hampton and?
I don't see patients in East Hampton anymore.
All right. Okay.
Southampton and Riverhead. And as of August 1st, I will be seeing patients exclusively in our Southampton office. There's another allergist who will be joining us part-time in the Riverhead office, so I'll be completely at the disposal of my
good.
Southampton and East Hampton patients.
I know we need you, and and adults who need allergy, they can come see you.
I would love to see them.
Okay, great. And I understand you're raising a couple of kids of your own also.
Three.
Three.
Keeping me busy.
All of that training, you must, your sleep quotient must be very, very low.
Not good. It's probably not good for my health.
I bet. And you're living in East Hampton as well.
Yes, I live in
Great.
East Hampton.
Good. Well, welcome. I should say welcome back. We're really
Thank
lucky
you.
to have you here. So today we're going to talk about ticks and your particular area of interest. And I should mention that you're a member of our tick panel. We have created the Tick-Borne Disease Resource Center here at Southampton Hospital. It has really 3 areas of focus. We are focused on providing education to our community. There's a lot of misinformation, unfortunately, about ticks out there, and we're eager to get good information. We're also trying to educate our local medical staff as well, so the doctors who are on our expert panel are helping to educate the rest of the medical staff as well. As much of the knowledge about ticks is fairly recent, and the spread of tick-borne diseases is rapid in the last several years,
Yes.
so we have a big sort of learning gap. And then the final area we are focused on is helping patients find resources. Somebody's been bitten by a tick or maybe has some of the symptoms they're worried about getting help, and we do have a tick hotline for people to call and hopefully guide them toward resources. You joined because you have a particular interest in one type of tick and one sort of issue. I know you're interested in all tick-borne diseases, but one area in particular, and you've actually become something of a national expert at this point. And so let's talk about that a little bit. And I know that the food allergy that's triggered by ticks is something called Alphagal, and let's talk about that. How you discovered it, and what is this exactly? So let's talk a little bit about what is Alphagal allergy and what ticks are spreading this.
Sure. So Alphagal allergy is the nickname we give allergy to galactose alpha-1,3 galactose, which is a carbohydrate that's expressed throughout the cells of all non-primate mammals.
Okay.
So humans and apes and monkeys don't express it, but any other mammal expresses it throughout their whole body.
Okay.
And what we're seeing with this allergy is that the Lone Star tick, which has become a really, really prevalent tick in our area, for some reason is inducing patients to develop an allergy to this alpha-gal allergen, which basically means that they're becoming allergic to meat from mammals.
Right. Okay. So that's quite a shock, I think, to most people to realize they can become allergic to meat.
It was a
through
shock to
tick-borne.
me when I first learned about it.
Let's talk a little bit about how you discovered that. What's the backstory? And tell me about your first patient, actually. When did you first see this?
So my first case of alpha-gal allergy, I diagnosed in 2010.
Okay.
I had read about, and I wish I could say I discovered the allergy.
Right.
Discovered that it was maybe here on Long Island, but
Right.
I give credit to my friend Scott Cummins and his colleagues down at UVA for discovering it in this country.
Okay.
My first case was a gentleman who presented with allergic reactions. He did not know what they were from, but he kept telling me the consistent part of the story was that he kept waking up in the middle of the night
Right.
with these severe allergic reactions. And initially he had suspected.
What sort of reactions? What were they?
So he very severe. He'd
Right.
wake up in the middle of the night with severe gastrointestinal symptoms, cramping, nausea, vomiting, diarrhea, hives, itchy
Right.
rash from head to toe. And when this particular patient would try to jump up to run to the bathroom to vomit or whatever, he would lose consciousness.
Really?
So he actually dropped his blood pressure and briefly lost consciousness. So my first patient was one of the most severe sort of presentations we can see with this allergy.
Wow. And he had no history of other allergies, or was it?
Well, he thought he was allergic to shellfish,
Okay.
but I've since proven that it was probably this all along.
The meat allergy.
I think it's a lot of that surf and turf sort of thing. People
Right.
eat a shrimp cocktail appetizer and then they have the prime rib for dinner, And shellfish is a food that's very commonly associated with allergy. So people automatically assume that that's what caused their reaction.
Okay. Yeah, we're all familiar with shellfish allergies.
Right, and
but,
everybody thinks they're allergic to shellfish, but shellfish allergy tends to happen immediately. So I
Okay.
was instantly tipped off when this patient was saying, well, I ate shellfish for dinner, and I was waking up in the middle of the night. That's not a classic presentation for a shellfish allergy.
Right.
But
right.
it is for alpha-gal allergy.
So you must have had some knowledge or heard about some other story somewhere that made you suspect this.
I
because
had
it's-
read a little, abstract, a little blurb in an allergy journal
Right.
back when I was still in Philadelphia, maybe a year or two before I moved here. But no one knew of the tick link at that point. It was very preliminary data, and it was just one of those sort of raise an eyebrow sort of things that you read, cases of patients having delayed allergic reactions to meat, and they
Okay.
believe this is the allergen, and that was about as much as I had heard of it. I never expected to see it. I thought it was one of those weird,
Right.
rare things that I
Right,
would never in
exactly,
my career
exactly,
see.
Exactly. So it was just kind of like a Sherlock and Holmes sort of expedition, just asking him questions and starting to put the pieces together.
Exactly. Well, the final reaction, the most severe reaction he hadn't eaten any shellfish.
Oh, really?
And he had eaten a big steak
Okay.
at East Hampton Grill or somewhere. And I thought, steak, that's the only thing that he ate. And then I kind of clicked in my head, wonder about that thing. And so I had to go back and look it up again.
Right. And previously, I mean, I certainly have never heard of people being allergic to meat before. Is that something that?
It was very
Extremely
unlikely
rare, I
and
would
rare.
guess.
I mean, as allergists, we say theoretically someone could become allergic to any food.
Okay.
But an allergy to meat was exceedingly rare. I don't think I had ever seen a true case of a meat allergy prior to this.
Okay. And there's a little story on researchers I know, which I've heard you tell, and I'd just like if you could tell people on the connection to a cancer drug and some folks at University of Virginia and
Sure.
Vanderbilt.
Yes. So that's actually was the beginning of the story.
Right.
Before they knew about the meat allergy, what they were seeing down there at Vanderbilt and at UVA and other southern hospitals were patients who were being treated with a drug called cetuximab, which is a monoclonal antibody. So that's sort of therapies of the future. That's where a lot of pharmaceuticals are going, targeted, making antibodies in a lab that can target specific factors or things in the blood or things in the cancer.
Okay.
So cetuximab is a drug that targets epidermal growth factor receptor, and it looked like it was going to be a very successful drug for the treatment of some colorectal cancers and head and neck cancers.
Okay.
But what they were seeing down there was a very high incidence of patients having anaphylactic reactions to the drug.
Oh, wow.
Much higher than what the preliminary studies had shown. The preliminary studies were showing an incidence rate of only 3 to 4%, and they were seeing upwards of 20, 30% of these patients having anaphylaxis. And what was even more interesting about the reactions was that it was happening with the very first exposure to the drug. So as an allergist, to give you a little background,
Right.
when you have a drug allergy, you need to have a primary exposure before you can develop the allergy.
Okay.
Because if your body's never seen it before, there's no reason you should be allergic to
Oh,
it.
I see.
If your body sees it, for some reason it doesn't like it and it makes antibodies against it.
Right.
So then you're fine until your next exposure, and that's when the reaction usually happens. These patients had never seen this drug before, and they were having anaphylaxis with the first dose. So what that was suggesting to the researchers was that for some reason, these patients already had a preformed antibody.
Okay.
It was already there, ready to react to this drug before they were ever exposed.
To something similar to the drug. So,
Exactly.
Okay.
And they thought it was even more weird because they started reaching out to colleagues who were treating cancer with this drug in other parts of the country. And they were saying, what are you talking about? Our patients are doing fine with this drug.
Right.
We rarely see allergic reactions.
Right.
So they had to try to get to the bottom of why there was this regional allergy to this drug.
All in the Virginia.
It was all in those five, so
Tennessee
Missouri,
area,
Tennessee, Virginia, North Carolina. That's where they were seeing the
Okay.
very high number of these cases.
Okay.
So they did an excellent study in the New England Journal of Medicine, and they were able to sort of break it down and characterize the allergen in this case. And the reason the drug had this allergen was because it was a mouse-human hybrid molecule, and it was bred in a cell line that had the gene for alphagal. So the drug
really?
actually had alphagal on
Okay.
it. Now, as far as I know, any monoclonal antibodies that they're making moving forward, they're making sure that it's
They
not
stay
bred
away
in a
from
cell
alphagal.
line that
Oh,
has
wow.
alphagal. They
Interesting.
used a second, the drug company that makes the cetuximab helped with the study.
Okay.
They remade the drug for the study in a different cell line that
Okay.
doesn't express alphagal, and the patients tolerated
They
it.
did tolerate it. Okay. So now we've got this weird reaction to a drug in a very specific part of the country. So that obviously got people thinking, well, what's different about this part of the country? right?
Exactly.
Okay.
And they were seeing within that New England Journal study was a little subset of patients who had never ever had cetuximab but had shown to have antibodies against alphagal
Right.
and were reporting delayed allergic reactions to meat.
Oh,
So and some of the cetuximab patients as well were reporting that. So they
Okay.
started to make the connection once they knew it was alphagal and that this is expressed on all mammals. They sort of made the leap to then start studying alphagal and its relationship to ingesting meat and these allergic reactions.
okay. And so how did they finally connect it to ticks?
Ticks.
Yeah.
A couple of different ways.
Yeah.
One was just that they looked at the distribution of cases of cetuximab reactions, and they looked at the distribution of cases to date of people who were reporting delayed onset allergic reactions to meat and had evidence of alphagal antibody. And they started looking at for what regional exposures people have down there that we don't have up here. And they looked at, fungi and molds and parasites, and they had a little suspicion for ticks just because historically
Right.
some of the patients were giving very good histories that
Right.
I ate meat fine, then I got a bunch of tick bites, and a couple of weeks later I started having reactions to meat.
Oh,
So,
okay.
so that sort of pointed them in that direction.
Right.
And then they did a really cool study where they did a couple things. One was they were able to show that patients who had antibodies against alphagal also had very high titers of antibodies against other proteins that are expressed in the Lone Star tick. So that sort of showed a correlation.
Right.
And then within the study, they were able to show 3 patients who were controls in the beginning of the study. They did not have any alphagal antibody. They were not reacting to meat. And then during the course of the study, these 3 patients reported frequent tick bites, and then they were able to demonstrate all of them started showing antibody against alphagal after the tick bites.
Really?
And 2 of the 3 actually reported reactions to meat. So that sort of sealed the diagnosis and the connection.
Yeah. So let's start to talk a little bit about the tick itself. It's the Lone Star tick, which I know from previous discussions there's several different types of ticks, deer tick, and there's a dog tick,
Right.
there's a Lone Star tick, and there's a
Right.
few others. We tend to see those 3 in this
Right,
area.
they're the biggies here.
And the Lone Star tick, was that specific to that area of the country at one time, or how is it?
That's sort of where, if you look back on CDC maps going back a number of years, it was predominantly in the southeast.
Okay.
But its range and territory has definitely been spreading.
Spread, okay.
And it probably will continue to spread. It's a very aggressive species of tick.
Is it? And so that's why we're seeing it more recently than we didn't see it. The tick just wasn't here.
Yeah, I don't know quite how the tick, there's a
Yeah.
lot of theories on how the tick got here. I think
Right.
some people believe that, it's just migratory patterns of birds.
Yeah.
Some people believe that it was actually inadvertently introduced here. I don't know that there's any way of proving that, but we
Right.
do know that part of the life cycle of the Lone Star tick is on the wild turkey,
Oh,
which,
really?
as I recall as a kid, was not here. I mean,
I
you
never
just
remember
didn't
seeing
see
wild
them.
turkeys.
And the Lone Star tick wasn't here when I was a child either. So
Okay.
there definitely, to me, is at least a correlation with the fact that we now have wild turkeys here and we now have these Lone Star tick here.
The Lone Star tick, is that the only tick associated with the meat allergy at this point?
In
or?
our country it is.
Yeah, okay.
In our country it is, but interestingly enough, you see alpha-gal allergy.
Yeah, I heard you mention earlier that these were the first researchers in our country, so
Right.
they've seen it in other
They
places?
sort of parallel identified the alpha-gal allergy right around the same time, both here and in Australia. There was a separate group doing work in Australia who identified the allergy over there almost around the same time.
Wow.
But yeah, you see it in Europe. You see it in Scandinavia. It's all over the place. But in different parts of the world, it's actually a different tick
Oh, really?
that's causing the allergy. So
Okay.
we don't know for sure, but in speaking with Scott Cummins, who's my friend and colleague down at UVA, and in speaking actually with Scott Campbell up here, who does a lot of tick research,
Right.
there's some thought that maybe potentially any tick could induce it, but for some reason the tick that's become the most aggressive feeder in a particular area tends to be the one that's most likely to induce it, because we do know that the more tick bites you get, the more likely you are to develop this
Really?
allergy.
Okay.
And you know, in speaking to Scott Campbell, the Lone Star tick is the one doing the majority of the biting these days.
Right. So we shouldn't assume that just because it wasn't a Lone Star that, there is a chance that
Yeah, I mean,
meat
it's
allergy
never
could
been
be
shown
right.
to be caused by the deer tick or the dog tick at this
Right.
point. But what I would say even more so is you should never assume that the tick that bit you was not a Lone Star.
Yeah, that's true.
That's, I think, a worse assumption to make, because there's a misconception out there that I think is really important to clear
Right.
up, which is that people think if they have a tiny tick, it's a deer tick.
Right.
And that is absolutely false. The nymph of the deer tick is what's most likely to transmit Lyme disease, mainly because it's the smallest, and as most people know, with Lyme disease, the tick needs to be on for an extended period of time.
So we miss it.
We
in
miss
our
it.
body, right?
But the Lone Star tick has a nymph as well,
Okay.
which is just as likely to bite a human as a deer tick. And since the Lone Star tick is actually more prevalent here, you're more likely, if you have a teeny tiny tick, there's a better chance that it was a Lone Star tick than a deer tick. So I've had patients make the mistake of thinking that they were okay because they thought it was a deer tick, but at least with respect to this meat allergy.
Right.
And it really was a Lone Star tick. And unless you're a tick expert, or unless you've got really good magnifying glass and you can compare it to a picture, they're about the size of a freckle. So it's very
Okay.
hard to distinguish the nymphs.
To tell which one is which. So, I know myself, I've taken some ticks off and said, oh, that's a Lone Star, or that's not
Right.
a Lone Star. I'm really
Right.
not an expert.
It's hard to
so,
tell.
yeah.
My daughter had a teeny tiny one on her
Yeah.
foot the other day, and I am sort of a tick expert,
Right.
and I'm looking at it and I'm like, I think it's a Lone Star, but it's hard to tell with those tiny ones.
Absolutely. And they don't all have the characteristic white spot in the back, I guess.
No, that's the adult female that has the white spot.
Oh, really? So the male
The
doesn't
male
even?
doesn't. The male
Okay.
has sort of a little bracket pattern along its back, lower back.
Okay.
The adult male looks different than an adult male deer tick or an adult male dog tick.
Right.
But it does not look like the adult female.
Most of us wouldn't know. So how many people have you treated at this point out here with the meat allergy?
And my last count is 252.
252 since 2011.
My first was in the end of 2010 was my
Oh,
first
wow.
case.
Wow. So let's talk a little bit what happens. I understand that, go out, have steak for dinner. What happens? What should people be alerted
Looking for. So the reaction, the interesting thing about this allergy to me as an allergist and to my colleagues as allergists is that there is this consistent delay
Okay.
from the time you eat the food until the time you react. So historically speaking, we've always been taught and we've always told our patients, if it's a food allergy, it will almost always happen within a half hour or less.
I've heard
usually
people
much
say
less than
they
that.
eat a shrimp and their mouth
Feel it
starts
in
to
their
feel
mouth
it right away.
instantly.
Right.
So people come to me sometimes and say, "Oh, I think I'm allergic to a food," and it's like, "Well, when do you get the symptoms?" "Oh, I ate it, and 6 hours later I got itchy." I said, "Well, we've always said that's not a food allergy.
Right.
You would be feeling the symptoms immediately. This is completely turns that whole idea on its head, because with the meat allergy, they eat dinner and they feel totally fine.
Right.
They like it, they eat it, they enjoy it. The earliest that we ever really will see the symptoms start is somewhere hour and a half to 2 hours, but more classically it's somewhere between 3 and 8 hours after ingestion is when the first symptoms start.
Isn't there a nickname for it? Midnight anaphylaxis?
Midnight
or something,
anaphylaxis,
right? Okay,
yes.
I've heard you talk about that
Yeah,
before.
because that's the most classic time that people are having these reactions.
Right.
You know, you figure they eat their meat meal at dinner, 6 o'clock,
Right.
and they go to bed, and 6 hours later is when they wake up from a dead sleep with hives or anaphylactic
Right.
shock.
And the reaction can also, you said it includes GI symptoms as well.
Very common.
Okay, so
Very common.
why the delay? What's different about this?
So it looks to be related to the fat content,
Okay.
the fat absorption, I should say.
Okay.
We know that people are more likely to react to meat if it's a fattier cut of meat.
Okay.
So unlike some other food allergies, with alpha-gal, it doesn't necessarily mean you're going to react every single time you eat meat.
Okay.
Some very sensitive patients will. Others may actually be able to tolerate small quantities of lean meat. So the classic story is always, you know, a burger or corned
Right.
beef or ribs. It's always something
With a lot of
fatty.
fat in it. Okay.
Fat, going back into biology and biochemistry, the process of fat absorption from when you eat it to when it gets absorbed into the circulation is a process that does take roughly 3 to 4 hours.
Oh, okay.
So we believe that it's when the fat hits the circulation that the reaction develops. Now, why the fat? When the allergen is expressed on all the
meat.
cells,
Right.
that we don't know yet.
Okay.
But that's why we believe there's the delay.
Is it all mammalian meats? You've talked about steaks, and what about bacon or a pork chop?
It definitely can be caused by those foods as well.
Okay.
For some reason, people do seem to be more reactive to beef, and we don't know why.
Yeah.
But for sure, I've had patients react to pulled pork. I've had patients react to bacon. Bacon I don't see all that often, but I think it's only because it's a small portion.
Okay.
You know,
Okay.
I mean, people aren't eating, you know, a pound and a half of bacon. They're eating a couple ounces.
Exactly. Even though we'd like to eat a pound. and a
I
half
would
of
love
bacon
it.
sometimes. Right.
So they do. So I have seen people
Right.
react to bacon, but
Right.
definitely pork,
Okay.
lamb,
Lamb, really.
lamb
interesting.
shank.
Okay.
venison.
Yeah, I was going to ask venison. It's all right. So any mammalian meat,
Any
even
mammal.
potentially if somebody likes rabbit or something. There's
I had someone call, a
okay.
funny thing is that a patient, my nurses love to kind of simplify things for people and just say, just avoid all foods with a hoof. And
Right.
in general, that's a pretty good recommendation, but
Right.
we did have a patient once call and ask if they could eat rabbit or squirrel.
Oh, wow. People still eat squirrel, I guess.
Apparently.
Okay, all right.
And my nurse sent me a funny
Not on-
question
not on
about
my
that.
menu, but
Not on
okay.
my
Yeah,
menu.
exactly.
Like, can they eat these? Because they have little paws. They don't.
Yeah.
And I said, no, they're still mammals.
Okay.
Remember your definition of a mammal.
All right. So what do you do once you suspect it? What kind of test do you do then?
So there's actually a very easy test to
Mm-hmm.
be done, which is just a blood test looking for the antibody, that allergy antibody, which is called immunoglobulin E.
Right.
You can demonstrate that people are making immunoglobulin E against alpha-gal allergen.
Okay, so and that's a one blood test, pretty definitive testing?
Nothing in allergy is definitive, sadly.
Right.
The clinical history is what's most definitive.
Okay,
In allergy, specifically when we're talking about food allergies, there is the possibility of getting a false or a subclinical positive test. So we're accumulating some data that suggests that people who get lots of Lone Star tick bites, many of them will have at least low-level IgE antibody against alpha-gal allergen, and they are not necessarily all clinically reactive.
okay,
So it's sort of a combination of a compelling clinical history, a positive test, and when I send an alpha-gal IgE, I also send a total IgE. So everybody has some amount of IgE allergy antibody in their circulation. People who have hay fever or
Right.
eczema probably have higher levels,
Right.
and people who don't have lower. And what's helpful for me in determining the likelihood that someone is clinically sensitive or very sensitive is not only what is their alpha-gal IgE level, but what is the ratio of alpha-gal IgE to total IgE, because
Okay.
the higher the ratio, the more reactive they are likely to be.
okay. So somebody discovers they've got this allergy. I mean, they have to give up meat for the rest of their lives?
Not necessarily.
Right, okay.
They always have to be aware of it.
Right,
The potential is always there.
right,
But we do know that as the distance from last Lone Star tick bite increases, their Alphagal IgE goes down and their clinical sensitivity decreases. So I've had many patients who really love their meat, who have been extra careful and have been able to go a couple of years without any tick bites.
right.
And they've actually been able to reintroduce meat, and many of them have even been able to go back to a completely regular diet, eating their burgers and their ribs. But what they need to be aware of is that if they get another Lone Star tick bite or a couple
So
more,
it's not like a lifetime immunity? They
once
could-
you've
yeah.
had the allergy,
You
you
can-
have the tendency for it to come back. So even if you've been able to defeat it by not
Right.
getting tick bites,
Right.
if you get more Lone Star tick bites, all bets are off.
Oh, boy. So we're unfortunately out of time, but there are a couple of quick questions I'd like to ask you about. One is, should people who've got an allergy to meat carry an EpiPen?
Absolutely.
They should, okay.
Absolutely. People have had anaphylaxis. People have needed to be
Been that severe
transported
that they, yeah.
by ambulance to the ER.
Okay.
So it's not that severe for everyone.
Right.
But the potential is always there. So absolutely, I make sure all of my patients have an EpiPen.
So not something to mess around with, clearly, if you've got this. And if you are waking up in the middle of the night with these sort of symptoms, it's something to
For
jump
sure.
on. Okay.
For sure.
And the other question we hear about chiggers, and I've heard there's some relationship to chiggers, golfers in particular, people out in grasses, and there's some misconceptions about chiggers. Can you quickly
Right.
go over that?
So I can't say with 100% certainty that there is no such thing as a chigger on Long Island, but what I can say with 100% certainty is that's not what is biting people
Right.
in late August and early September.
Right,
Those are Lone Star tick larvae.
okay,
And the bites are, there is such a thing as a chigger.
right.
But chiggers are not biting people here
On Long
on
Island.
eastern Long Island.
Yeah, I've
That
heard
is
they're
the
primarily in the south, so,
right. That's the time when the Lone Star tick larvae hatch.
okay,
And those bites are very potent triggers for inducing this allergy. And I
Okay.
see it all the time. So I don't like getting into arguments with people about
Right.
are they chiggers or are they Lone Star tick
Right.
larvae? You can call them chiggers if you want.
Right.
They are Lone Star tick larvae and they can cause this allergy. So
Right.
it has to be taken seriously.
So bottom line is, if you've been bitten by a tick or chiggers, this is one more thing to keep your eyes open
To be
for,
aware
right,
of. I don't
exactly
recommend
right.
routine testing for it
You don't.
because of what I told you, that
Right.
you can get subclinical positives.
Right,
And then what do you do with that information?
exactly.
Some people get so anxious. What I usually just tell people is, if you're nervous about it, lay off the meat for a couple of weeks and
Right.
then kind of gradually reintroduce it. That's what we do in our house if we get a Lone Star tick bite.
Okay.
Because most people are going to be fine.
And any advice for parents with kids as a final remark?
Oh, I think you just really need to take every precaution. My kids get tick bites, and it's very hard to avoid. But
Right.
I really think the lesser of two evils is using bug sprays with DEET, using insect repellents with permethrin on the shoes and clothing, which can last through many washes,
Right.
especially the shoes and clothing that they're wearing out on the ball field,
Right,
or
right.
when they're spending
Yeah.
time outdoors, or their sneakers that they wear all summer long.
Right,
Tick checks every single night when
Right.
kids come in, bathe them, tick check them. I would recommend getting yards sprayed, make sure you're treating your pets.
right.
Any precaution that people can take is just going to keep us, healthier as a whole, not only with the Lone Star tick and the Alphagal allergy, but with all these tick-borne diseases.
And a level of vigilance, I guess,
Absolutely.
now, hopefully. Well, there's so much more I'd like to ask you, but unfortunately, we're out of time. I really thank you for being here and for the great work you're doing in our community. And I do know that Dr. McGintee, if anyone would like to see her and ask her more questions, is available in her offices at ENT and Allergy Associates at Benton Plaza in Southampton, and also in Riverhead. If you'd like to make an appointment, she can be reached at 631-283-1142. Also, if you'd like additional information about ticks generally, feel free to call Southampton Hospital's Tick-Borne Disease Resource Center. Our website is at www.eastendtickresource.org, and our telephone number is 631-726-TICK. That's 726-TICK. That should be easy to remember. And we do have nurses on those lines for advice or just guidance in finding good doctors like Dr. McGintee. So thank you again, Dr. McGintee, for being here. Thank you all for watching. Thank you to CTV for producing this show and airing it in our Southampton communities. And once again, thank you to LTV for airing it in our East Hampton communities. If any of you have any ideas, suggestions about additional programs you'd like to see or learn about, please give us a call. Or if you just need help navigating navigating the health system here on the East End, please feel free to call my office at 631-726-8555. Thank you, everyone, and good health.